Three main reasons for why the redesign took place. Over recent years, our community mental health teams were seeing an increase in referral demand. And what we saw in mental health services at the time was a steadily increasing caseloads. Caseloads were getting to a level whereby we weren't able to deliver or offer anything particularly therapeutic, but it was all about containment rather than helping our service users in their recovery goals and getting back into their communities.
The ultimate endpoint that we're looking to get to is that situation where when somebody comes to our service for the first time, they do meet someone that has the time and space to sit down and talk to them and listen to them and make sense of their difficulties with them. And that they can use that information to develop an understanding that makes sense to them and makes sense to the person that they're working with, and then use that understanding to develop a plan that really feels genuinely meaningful and helpful to the individual, and then work through them with delivering that plan of intervention.
Back in 2012, we had merged together older people's community teams, adult community teams, into an ageless locality mental health service, if you like. That had some unintended consequences that weren't anticipated. I think the intention by doing that was a good intention in terms of trying to pull together the expertise within local areas. Because the community mental health teams lost its way in terms of purpose, you could be denied access to a mental health team in the west, change your GP, move to the east, and the team in the east would accept you. So it became really confused. It created tension with our partners, particularly GPs and primary care, because there was no rhyme nor reason in terms of who was being accepted for treatment and intervention and who wasn't. This was really not a positive experience for service users.
It's about the experience of the people that come to the service. But I think we know there are different things that you need to do to achieve that. So part of it is about ensuring each member of staff is equipped and skilled to do those different tasks.
We started off with the older people's redesign, and that was largely because that was the biggest driver of knowing that we were really doing a disservice to our older adult population in terms of mental health provision. As we started to unpick that, it soon became apparent we can't redesign older people's services without re-looking at making our adult services much more purposeful, much more focused on recovery, and much more engaging with service users and carers. What we've chosen to do this time, which I think has been the right way to effect the change, clearly involves service users and carers as active participants and partners in that journey. We had Forum Central, which is the representative of the voluntary sector in Leeds, as an active partner.
I work at Forum Central. We're the health and care third sector network for Leeds. So our role is to support and represent the third sector. We really strongly believe that people with mental health difficulties deserve to get the right support in the right place at the right time, and we really want to make sure that we as a third sector can support that both in the work that our members do, but also working in partnership with statutory partners, including Leeds and York Partnership Foundation Trust. We became a part of the Community Redesign Project Board to represent the third sector, and we work with the Trust to deliver a series of engagement events.
It was really important as part of that engagement that we took the feedback and went back to people and said, this is what you told us and this is what we've done. So we've done that to every partner agency through a report.
In terms of the feedback that we got from our membership around the redesign, it was really good for people to be able to have their say, to talk about what they felt the implications might be for their own services in terms of the Trust's redesign, and to maybe share their concerns, but also their ideas around opportunities for being able to work better together in partnership.
It's important to note that this change isn't moving from something on a Friday to a state on a Monday, and that's the change done.
As an organisation, we have a structure that's focused on making sure that the teams are working so that they support the individual, so that they support the service users at the end of it. And that's the end point that we're looking for.
Something that we're really clear about and we're really passionate about is that partnership opportunity, and we want to make sure that the Trust can learn from the third sector, and also that we can learn from our colleagues within LYPFT in terms of best practice to make sure that we are really delivering and able to support people in the best way possible.
We need to change the culture. We need to engage partners, service users and carers in an ongoing process of how we evolve this model, because ultimately service users that access the service are the experts in what they need